At the start of the Roman Empire, there was no such thing as formal medicine. Like the majority of other civilizations, they relied on very basic herbal medications and simple health practices to keep them fit. They continued to have these very basic practices up until the eventual decline of the Greek Empire. With Greece falling to foreign invaders, medical professionals began moving to Italy, which seemed to be on the start of a new age. With the influx of Greek culture and information, Roman culture flourished, as well as its knowledge on medicine. For a long time, Greece was in decline. After many bloody wars, political instability, and invasions from other civilizations, the empire began to fall. These Greeks looked desperately for a place to turn to, which at the time seemed to be found in Rome. Many Greeks began migrating to Rome in search of better opportunities in the medical field. When the Greeks first arrived, they were shocked at how primitive the practices were there. Instead of having individuals who were responsible for healing the sick, the fathers of households, or heads, were supposed to know which herbs could suppress certain ailments. These were very simple, like giving opiates such as morphine to get rid of pain or herbs to help treat rashes. There is a reason for the lack of sophistication in Roman medicine. Instead of focusing on how to make people healthy again, they stressed the importance of staying healthy in the first place. They made large reforms of their city systems to make sure everyone had access to clean water. They introduced sewage systems to keep waste away. They drained marshes to bring water to the city, and also to get rid of mosquitoes, which could cause many of their diseases. They advocated the importance of being physically fit, as these would all be the best way to treat sickness. These types of ideas are still pretty common to this day. They didn't believe in the concepts of germs as we see it, but they were effective at keeping them at bay. Greek doctors weren't treated as highly as they should have been at the time. The majority were either POWs or lowly doctors who treated people in the city. One of the first successful doctors was the Greek physician Archagathus. Arriving in 219 BCE, he began to call for the standardization of medical practices. He prescribed herbs and small feats of surgery to keep Romans healthy. Another main physician of the time was Dioscorides. He arrived from Greece in the 1st century CE. After arriving, he began to study almost every type of science, including botany, pharmacy, and pathology. He began working for the Roman Emperor Nero and his political cabinet. After his decades of work, he published the De Materia Medica. In this book, he listed over 600 types of cures from herbs and concoctions that would be easy to make. This book would be used over 1500 years until the Renaissance ushered in a new medical age of information. One of the most famous of the Greek physicians was Galen. Interested in how to understand the human body, he turned to dissections. Despite it being illegal to perform them on humans, he began to cut open animals and war criminals. Slaves and war criminals were not subject to the same rights as normal citizens. After years of strict research in this, he began giving lectures, writing books, and performing public demonstrations. He performed medicine under the Emperor Nero and his advisors. His practices started with an extremely thorough physical exam, previous medical treatments, then prescribed treatments. His practices would go on to be the foundation of modern-day Western medicine. There is a fairly large flaw with Roman medicine, however, and with most ancient medicine. This was the theory of four humors. This medical idea was there were four fluids in the human body that controlled how people acted. These were blood, phlegm, yellow bile, and black bile. They determined these by bleeding patients and waiting for it to dry. When the blood would separate into its different components, that being the blood clot, black bile, the actual blood, clear yellow serum, the yellow bile, and white blood cells, which they called phlegm. They believed that the entire body was made up of these components. If there was an imbalance between them, or if one was too abundant, people would get sick. If there were too much black bile, the patient would experience depression-type symptoms and just be generally melancholy. If there was too much yellow bile, the patient would become too aggressive and violent. Too much phlegm, the patient would become apathetic and quit taking care of themselves. They didn't believe that an excess blood had any effects, so they never worried about it. To help balance these, they would cut the patient, let them bleed for a while, then get them to stop, now thinking that the patient would be fixed. These ideas now seem backwards and completely wrong, but still played a major key in ancient Roman medicine. Tools used in ancient Roman medicine were very crude, but effective for what they needed at the time. One of the most common tools was the scalpel. Generally used for slicing open skin and organs, these bronze or steel knives weren't very sharp, but it still got the job done. Another common tool was the catheter. Their catheters were generally made of bronze tubing and were used to help drain the bladder or other parts of the body with excess fluid. Less common tools used included bone drills. These crude instruments would be hand drilled into bones, causing the bone to fracture and eventually be removed. This would be done for bone diseases or for shattered bones. Another tool was obstetrical hooks. These metal hooks were used to keep incisions open while doctors were performing surgeries. Finally, another common tool was the vaginal speculum. Amazing due to its complexity, it would be used to examine the vagina and uterus. The Romans believed in hysteria, or the thought that the uterus was the driving force behind female instability. Using the speculum, they tried to investigate the female body to try to cure hysteria. Most surgeries done in Roman times were either superficial or for aesthetic purposes. Battle wounds were extremely common in Roman times, so plastic surgeons were heavily employed to keep people looking normal. The most common type was ear reattachment surgery. Surgeons would cut away scar tissue as well as extra skin and would sew the ear back where it should be, trying to make it look as normal as possible. Surgeons mostly were used to get rid of scars, but they would get even more complex. One of the most complex surgeries they had was a glaucoma surgery. In this surgery, the lens of the eye, clouded over due to the glaucoma, would be removed from the eye with a sharp needle. They would insert the needle, cut into the corneal layers, and pull the lens out from the eye. How well the patient could see after such a story is debatable. Other types of surgeries they would do included many types of cancer resections. In these, cancerous tumors would be found then carefully cut out, trying to remove as much of them as possible. Yet another type of surgery was trepanation. Despite looking strange to us, it was incredibly common in ancient civilization. Trepanation, or cutting holes into the skull, would be used on patients complaining of headaches, migraines, and certain mood disorders. This type of surgery technically works, as it would allow the brain to have more space to fill, but they were increasingly prone to infection. These would later go on to inspire the lobotomies of the 19th and 20th centuries.
For over 1,600 years, Roman medical practices would dominate Western medicine. The Romans brought mass interest in science to other civilizations, especially medicine. With all of these civilizations practicing it, medical ideas continued to advance. Basic Roman practices led to more sophisticated surgeries and types of medicine. Germs and other pathogens were discovered, leading to the age of modern medicine, with physicians being able to treat specific diseases with specific medications. Diseases were treated much easier and had much higher success rates. Thanks to the Romans becoming interested in medical practices, modern medicine will continue to advance going into the future.